Sexually transmitted and sexually associated infections remain a significant public health issue across the world. While global attention is often focused on well-known sexually transmitted infections, such as HIV, syphilis, gonorrhea, and chlamydia, there are less commonly discussed bacterial infections that can also affect the genital tract and cause serious health consequences. One such infection is Shigella genital infection. Shigella is traditionally known as a food and waterborne bacterium that causes gastrointestinal illness known as shigellosis. However, in recent decades, medical research has increasingly documented cases where Shigella species infect the genital and anorectal regions, particularly through sexual transmission, especially during certain sexual practices. These infections may involve the urethra, rectum, genital skin, or surrounding tissues, and they can be easily misdiagnosed if healthcare providers are unaware of this transmission route. This video aims to provide a complete, in-depth educational overview of Shigella genital infection. We will discuss the history of Shigella, the bacterium itself, how the infection spreads, symptoms, diagnosis, treatment, prevention strategies, countries where cases are reported, and the public health importance of recognizing this infection early. If you value accurate, stigma-free health education, make sure to subscribe to the WUT News YouTube channel for more informative content on sexual health, rare infections, and global medical awareness. What is Shigella? Shigella is a gram-negative bacterial genus that primarily infects the human intestinal tract. It belongs to the Enterobacteriaceae family and is closely related to Escherichia coli. Shigella bacteria are highly infectious. In fact, as few as 10 to 100 bacteria can cause illness. There are 4 main species of Shigella: Shigella dysenteriae, Shigella flexneri, Shigella boydii, Shigella sonnei. While these bacteria are best known for causing severe diarrhea, fever, and abdominal cramps, they are also capable of infecting genital and anorectal tissues under certain circumstances, leading to what is referred to as Shigella genital infection. Historical background of Shigella infection. Shigella was first identified in 1897 by Japanese bacteriologist Kiyoshi Shiga, after whom the bacterium was named. He isolated Shigella dysenteriae during a large dysentery outbreak in Japan and demonstrated its role in causing severe intestinal disease. For much of the 20th century, Shigella was considered exclusively a gastrointestinal pathogen, transmitted through contaminated food, water, or poor hygiene. However, by the late 20th and early 21st centuries, clinicians began reporting cases of sexually transmitted shigellosis, particularly among adults engaging in certain sexual practices. Medical literature gradually recognized that Shigella could be transmitted through direct fecal-oral contact during sexual activity, leading to infections of the rectum, genital area, and urinary tract. This shifted the understanding of Shigella from a purely foodborne pathogen to a sexually associated bacterial infection. Understanding Shigella genital infection. Shigella genital infection refers to infection of the genital or anorectal region caused by Shigella bacteria, usually through sexual exposure rather than food or water. It is important to note that Shigella is not a classic sexually transmitted infection, but it is sexually transmissible. The infection may involve the rectum, proctitis, the urethra, urethritis, the external genital skin, surrounding pelvic tissues. Because symptoms may overlap with other sexually transmitted infections, Shigella genital infections are often misdiagnosed or overlooked. How Shigella genital infection spreads. Primary mode of transmission. The primary route of genital Shigella infection is fecal-oral transmission during sexual activity. This may occur through oral anal contact, anal intercourse, genital contact with contaminated hands or surfaces, poor hygiene before or after sexual activity. The bacteria enter the body through mucous membranes or microscopic breaks in the skin, allowing infection to establish itself. Why Shigella is easily transmissible. Shigella has several characteristics that make it highly infectious: extremely low infectious dose, ability to survive briefly outside the body, resistance to stomach acid, rapid invasion of epithelial cells. These features explain why genital and anorectal transmission can occur even without visible contamination. Incubation period. The incubation period for Shigella infection generally ranges from 1 to 7 days. In genital or anorectal infections, symptoms may appear quickly or develop gradually depending on bacterial load and immune response. Signs and symptoms. General symptoms: fever, fatigue, body aches, malaise. Genital and anorectal symptoms: rectal pain or discomfort, painful bowel movements, mucus or blood-stained discharge, genital irritation or inflammation, burning sensation during urination, swelling or tenderness in the genital area. Asymptomatic cases. Some individuals may carry and transmit Shigella without symptoms, which increases the risk of unnoted spread. Complications of untreated infection. If left untreated, Shigella genital infection can lead to chronic proctitis, persistent urethritis, secondary bacterial infections, dehydration if diarrhea is present, increased risk of HIV transmission due to mucosal inflammation. Prompt treatment is essential to prevent complications. Diagnosis. Diagnosis of Shigella genital infection includes clinical history and symptom evaluation, stool testing if diarrheal symptoms are present, rectal or genital swabs, PCR or culture testing, antibiotic sensitivity testing, important due to resistance. Accurate diagnosis is critical because antibiotic resistance in Shigella is increasing globally. Treatment options. Shigella genital infections are treatable with antibiotics, but treatment choice depends on local resistance patterns. Commonly used antibiotics include azithromycin, ciprofloxacin, ceftriaxone in severe cases. Supportive care such as hydration and symptom management is also important. Antibiotic resistance, a growing concern. One of the major challenges with Shigella infections is multi-drug resistance. In some regions, Shigella strains have become resistant to commonly used antibiotics, making treatment more complex. This highlights the importance of laboratory testing, completing prescribed antibiotic courses, avoiding unnecessary antibiotic use. Prevention strategies. Preventing Shigella genital infection involves a combination of sexual health awareness and hygiene practices. Practicing good hand hygiene before and after sexual activity, using barrier protection such as condoms and dental dams, avoiding sexual contact during active symptoms, regular STI screening for high-risk individuals, prompt treatment of infected individuals and partners. Education plays a vital role in prevention. Global distribution. Shigella genital infection have been reported in United States, United Kingdom, Australia, Canada, parts of Europe, Southeast Asia. Outbreaks are often associated with urban centers and closely connected sexual networks. Public health importance. Shigella genital infection is important because it is easily transmissible, it can be mistaken for other STIs, antibiotic resistance is increasing. It highlights the need for inclusive sexual health education. Public health authorities emphasize awareness, early diagnosis, and responsible antibiotic use. Living with and recovering from Shigella genital infection. With early diagnosis and proper treatment, most people recover fully. Symptoms resolve within days to weeks. Long-term complications are rare. Follow-up testing may be recommended to confirm clearance. Reducing stigma through education. Shigella genital infection is not a moral issue. It is a medical condition that can affect anyone. Reducing stigma encourages people to seek care early, protecting both individual and public health. Final message. Shigella genital infection is a rare but medically important sexually associated bacterial infection. Awareness, early treatment, and preventative measures can stop its spread and prevent complications. For more trusted, educational, and awareness-focused health content, subscribe to the WUT News YouTube channel. Stay informed, protect your health, and help spread knowledge that saves lives.